Hello, everybody. I'm going to give it one more minute to get started. I have 6 o'clock straight up, but I'm going to give it one more minute. Okay, we got 6:01, so it's definitely time to get started. We're a little past time. My name is Brian Dowd. I am the Deputy Executive Director over Policy Operations and Compliance at the Department of Community Health. And I believe this is our November, December, January, February, March, our 5th month in a row of town hall meetings. I want to take the start to thank everybody for joining us. If you do have questions, please put them in the Q&A section and not in the chat section. It's very helpful to have those in the Q&A section and not the chat section. I do also want to let folks know that if you can't hear, you probably are using headphones. Well, if you can't hear, you're not going to hear this. So we'll respond to you in the Q&A on that one. But if you do have headphones, that tends to be the problem with not being able to hear. We have 1 or 2 of those on every single town hall, it seems. Also, for questions tonight, we are going to only be responding to questions related to the training. If you have other questions, I've already got 1, 2, 3 that are really the same question in the Q&A. We will gather those questions up. This one is specifically for Acumen, and we will have it addressed with the Acumen staff. And they can reach out to you or put it as part of their upcoming FAQs that they are going to have, or do direct reach out to you on your questions. So we are only going to be answering questions related to the training tonight, but that doesn't mean that you can't utilize the email box to send it to us, or we can capture your questions and make sure that they are addressed. Okay, next slide. We always start all of our presentations at the Department of Community Health with the mission of the Georgia Department of Community Health, which is to provide access to affordable quality health care through effective planning, purchase, and oversight. So here's what we're going to be going over tonight. We're going to do some EVV quick reminders, status updates. We're going to go over the functionality phases and how we're moving forward with EVV. We're going to give you all the communication resources that are available to you, and there are a lot. And then Telus is going to do an EVV training overview and a third-party EVV vendor update. After that, we'll do Q&A, and the Q&A is going to be limited to the training overview and the EVV vendor update, but we'll talk about how to get written responses to your other questions as part of my update. Next slide, please. Thank you, Joe. So here's a few quick reminders. I got this week questions again about what services are covered by EVV. So this is a slide that is available in several of our presentations. It's also available in the frequently asked questions, and it's available on our website. This breaks down exactly the waivered services by individual waiver that is covered in EVV. CLS, consumer-directed CLS, personal support services, personal care support services in GAP, and personal support services consumer-directed. So it is only for CLS and PSS only. Those are the only things that are covered by EVV, not ALS, not CAG, not CAI, not structured family caregiving, not community access group, community access individual. I'm trying to think of the ones that I keep getting asked. None of those. If it's not on this chart, it's not covered by EVV. Next slide, please. So let's go over the status. We are on schedule and marching forward with EVV, which is very exciting for us. We're still onboarding third-party EVV vendors. We're working on that every day. And our call center technical support will be available as of 3/29. So the call center is going up 3/29. So March 16th, 2021, we're going to have that provider training that opens. Then at the end of March, everybody will be able to do provider registration as they see fit, beginning March 29th. April 1st, the system will be fully ready. We'll have our initial training that we've done through March. Actually, it's been going on for 2 years. I went back and looked at my timeline recently, and we started in 2019 with statewide town hall meetings. So it's been a couple of years that we've been doing training, and Joe and I have been doing these town halls since November. But the training we're talking about today, that will be initially complete on April 1st, and then we'll move into ongoing training, ongoing availability of training in April. In May, we're really going to focus to recruitment campaign because we need everybody utilizing the system for claims payment in July. So we're going to be doing that in May. Very big recruitment campaign to try and get everybody on board. Also, we're going to be doing system refinement. So we're doing UAT testing, and we really haven't had many issues with our UAT testing so far. But if there is some sort of little tweak from everybody using the system to make it prettier or make it more user-friendly, then that's what we're going to be doing in the May-June era, in the May-June timeframe. July 1st, EVV is going to become mandatory for claims processing. So I've said this on several meetings now, that effective July 1st, all claims processing will need to go through the TELUS platform. So EVV functionality phases, this is, again, it's more of a reiteration, kind of a dive deep into what I just said. Phase 1, we will have full EVV mobile application available for anybody to use and administrative portals. That's including your dashboards, your reporting, your scheduling that we've gone over in previous town halls. All that will be available. Also, for those who have been approved for telephony, telephony will become available as an alternate method to the app on the phone. And again, the call center will be available as of 4/1. Late May 2021, the claim submission functionality will become available. So can be used if we so choose, and we hope we do. We get a lot of providers on board because that will make your claims processing a lot easier than you do now, 1. And 2, it'll help test the system for when it becomes mandatory July 1st. Also, late May 2021, fixed devices will become available for anybody who has been approved to use a fixed device. So again, 7/1 claims are required to go through TELUS, and we'll also add some additional functionality that kind of look in for the case managers and support coordination so they can see what is going on with reporting for their providers. So during phase 1, what do you need to do as a provider? Here's really some of the first steps you need to do. So during that first phase 1, when the system comes live 4/1, you need to register your administrator, who's going to be the person who's looking over that dashboard, or the people who are looking over that dashboard, administrator or administrators. You need to work with aides, your aides, to make sure that on their phones they have that application downloaded. You need to register your aides as users in the system so that they are your caregivers and we know that you're their caregiver. Then you're going to have to load the schedule and member data. We will get a member file, but we're going to need those schedules loaded. Joe is going to talk about the complete training and working with the administrators, so he's going to go over that. So we need you to really take advantage of all of the online training that is available. And we need you to determine if any members will need the use of telephony or a fixed device to apply for that, to request from the state that they get, that they don't have to use the application on their phone and they can use telephony or a fixed device. And then finally, We just need you to begin using the EVV mobile map with members as of 4/1. We will be releasing a provider checklist to help you go through this process and know what is in the next steps. Next slide, sorry. So before I go over the communication tools, I want to answer one question I got asked: what's involved in the recruitment process? What's involved in the recruitment process is making sure you're onboarded to use the EVV system as required by the federal mandate. Again, effective 7/1, all claims will have to go through TELUS. And it is a federal mandate. Everyone who uses CLS or PSS must comply with EVV. There are no exceptions. So that recruitment campaign is just to make sure everybody's involved, everybody has the training resources they need, and everybody is on board with using the EVV system. Okay, let's go over communication resources. I know I've done this a bunch of times, but I want to go ahead and do it one more time. This top spot is the EVV website. It has all the information we've gone over today. That includes every single presentation, every recording of every single presentation. It includes flyers and announcement, member and provider readiness surveys, frequently asked questions, town hall materials, and recordings. Everything is on that website. It's very, very rare that I get asked a question that is not on our EVV website. And guys, if you don't know the EVV website, if you don't want to write this down, you don't have to. Go to any search engine, Google, whatever. If it's, whatever the search engine is that you prefer, go to that search engine and put in EVV Georgia or GA or EVV DCH. That website will pop up immediately. You don't have to write down the website. Just put in EVV DCH Georgia, and it will be the first thing that comes up. Or even EVV GA, and I think it's the third thing that comes up then, because some people have put a couple of ads up. But you'll know it's us because it's got Medicaid and Georgia and government in the tagline. So you don't have to remember that. Just go ahead and do that. If you have individual questions that you want responded to or questions that are not associated with the training portal tonight, please send them into the EVV mailbox. It's evv.medicaid@dch.ga.gov. You can copy that. You can it's in all of our communications we've put out. We respond to every single question that goes into that mailbox. I recently went back. Literally, we have responded to thousands of individual emails in that mailbox over the last 3 years. So if you're like me and you like a personalized answer and you like it in writing, so it's not just a question that you hear over the phone or something in a presentation, I would encourage you to use that mailbox to get your questions answered. Next slide. Okay, now I'm going to turn it over to Joe Schnurr, who is the Chief Customer Officer for TELUS NetSmart, and he's going to take over the training from here.
Awesome. Thank you so much, Brian, and good evening, everybody. It's great to be with you. It's as Brian pointed out, we're almost at the starting gate, right? 4/1 is when we can actually get started to use EVV. We've been preparing for years now, communicating, and now we're right about to start. So I know lots of you are ready to start learning how to use the system. So that's why tonight we are going to focus on how can you all be trained on the solution. Okay, so and I want to get through all this because we want to leave plenty of time for your Q&A. So first is kind of best practices. So I've implemented EVV across multiple different states, and so I've learned what works best across those different experiences. So I just wanted to share those with you tonight. So first, from a timing, and what is this? This means, when should you go to training? So what we have found is that it's most productive when you train after you have access to the application. Now, we're happy to support you if you want to train early. That's not a problem. And you're going to see from the dates, we are going to start training before you have access to the system, because some people do like to get a head start. That's not a problem. What I will ask is if you do train early, that you retrain once you have access to the application, because you will forget things. And rather than just trying to figure your way through it, we really do ask that you retrain, go through the training again, so that you have a good experience. Okay, what are the different models that we deliver the training? So what we've also learned is that users, they learn different ways, and they like to consume the training content in different ways. So we deliver the content in multiple different models. So first is live webinars, very much like we're doing tonight. So we do live training webinars, and I'll show you the schedule. We do those weekly, and that allows providers to come on, listen to a trainer live, and chat in questions. Again, very much like what we're doing tonight, where we share information, and then you can chat in questions if you don't understand something. And you can attend those as many times as you want. And we have many providers that honestly, they will attend the webinars 2, 3, 5 different times. So we welcome that. We want you to learn. And if it takes you a couple times to go through it, that's not a problem. Okay, second is some providers, they like to self-help. They want to train when they want to train, whereas the live webinars are more scheduled at a certain time. We also provide the training where it's on demand. So you can listen to a video, which, by the way, we also record the live webinars, so you can actually even listen to those whenever you want. So maybe in the evening after you've done your full day's work, that's when you want to do your training. Maybe you're an early riser and you like to get up early and you want to do your training then. Not a problem. We will support you through the on-demand methods. Some providers, we've learned, also like to be able to pause the training and then go do a few steps and then play more of the training. So the on-demand videos allow you to do exactly that. So you can have a video up, you can watch a part of it, it'll show you how to do something. Then again, once you have access to the tool, you can go into your tool, you can do those few things, go back to the video, and so forth. And then lastly are the user guides. And this is for those that really prefer to read over watching videos. And some even prefer to print out certain pages. And so that is available through the user guide. Okay, so this is, again, sort of a recap. The live webinars, which again, we do record those. We offer those in modules. Again, I'm going to do a quick demo and show you all of this. There's a registration website where you go and you sign up for those live webinars. Videos on demand. Again, there's a website. It's all accessible actually through the dashboard. And we break out the modules into very short videos that allow you to see certain parts of the application. And then the on-demand user guides as well. So I'm going to show you all that on the websites tonight. In general, we try to break the content down into consumable pieces. Again, one of the best practices is, you know, you might not have 30 minutes or an hour to sit through a long webinar. So you might just need a quick refresher on how to schedule a visit. So we have a short 9-minute video on how to schedule a visit, and so forth. So you can see there's multiple different topics. There's actually more than I even have listed on this page, but this is just to give you an idea how we break things down by the admin console, the mobile, claims, and then we might have some examples where there's some special topics. Okay, so here are the training dates. And again, this is for the live webinars. So here's how we do it. Every Tuesday, we do the mobile application. So you can see all the dates in March and April of when you can go online and register for the mobile application. So it's every Tuesday. For the admin portal, we do it every Wednesday. And for the claims, we do it every Thursday. The only exception would be if one of these days fall on a holiday. So that's what you can expect for, again, the live webinars. And I'll show you where you go to sign up for those. Okay, so now let me get out of the PowerPoint and let me log in to the actual portal. Let me,
while you're doing that, I'm gonna answer, well, not answer one question, but I'm gonna go over one question. There was a very good question about what is the Acumen system. That was the first question that I got today, broken up into 3 different questions that started even before the training started today. I want to ensure that we will capture that question. So Lee, Clovis, and Brittany, if you can write down the first question that is in the Q&A, we need to do the folks at Acumen so we can get a response for it, okay?
Okay, will do.
Okay, thanks, Brian. Okay, so I am logged into our fortellus.com website. This is our home website. And the reason I take you here is because you'll see right on our home website, training webinars. And if I click on this, it's going to bring me to the training webinars page. Now you can also just type in this page and it will also take you there. But just in case you forget, if you figure out how to get to, if you just look up Tellus, you'll find us, and then you can quickly get there right from our homepage. So if you scroll down a little bit, you'll see these are the different webinars the different categories of webinars around the admin console, the claims console, the mobile application, and then extra topics. And for those of you that may have missed some of our previous town halls, we actually did demos and overviews of each of these sections. So I do encourage you that if you missed any of those, that you go to the DCH EVV website that Brian pointed out, and you can actually go to the previous town halls and see overviews of those. So I think those are actually very helpful if you haven't seen them. So you're on the training website. And then if you page down, you'll see the different training webinars. So here's the admin console one. We tell you who should attend. So administrators using the TELUS EVV Administrator Console, and those who are doing in charge of like scheduling. And what are you going to learn? You're going to learn how to import your data, how to schedule your caregivers, and everything in between those. You can see the register button. If I click the register button, it's going to bring me to the page on how to register. And it's going to give me a drop down with options of what dates I can select. Then I'm asked to fill in some information. You can see certain fields are required, such as wherever the asterisk is, so first and last name, what state you're in, what organization you're with, which agency you're with, your phone number, and your job title. And then you come down here and you click register, and now you are signed up, and you will get an email with a notification for that webinar. So it's very easy to register, and you can see that for each of these, there's a register button. And that's as simple as it is to register. Now, remember, these are for the live webinars, which are a specific time of the day. So you do have to be available. And if you might be busy at that time, no problem. we record these, and you just click the view recording. We also record them in Spanish for those that are Spanish speaking. So that's where you can see these buttons. So if you want to view the recording in English or Spanish, you just come here. And again, you can see we have those for all the different categories. So that's as easy as it is to get signed up for a live webinar. And remember, we're getting started on the 16th, March 16th, which is only 12 days away, with the mobile app training. So if you have any questions about that, please do put it in the Q&A section so we can answer those questions. Okay. Now, once you have access to your portal, and this is the portal that we've went through in previous town halls, you'll notice in here, we did talk about this and said that we would come back and go through the training tab. So in this left menu over here with all these different categories, there's one called training. So if I click on that, there's a little tab that says go to training. If I click on that, it opens up a separate tab for me. And this site is protected with your user sign-in. So you do have to have your user sign in to get to this page. So when I clicked on it, it passed my credentials over, so it automatically signed me in. And if I page down, you can see I have all these resources available to me. So here are the user guides. So let me click on the user guides. So again, these are, you can review these or you can print them. You'll notice that we have them broken out by the admin console, the claims, the mobile application. So that's pretty consistent across the platform, and you can view the PDF. You'll also notice that it's in Spanish as well. So for those of you that need Spanish, we've already done all the conversion for that. So if I want to view a PDF, I click on View PDF, and now it's going to open up that PDF, and I can print out pages if I want to. I can just keep this on my my screen and go through this. You can also see where as I hover my mouse, it allows me to go to certain pages. So let me find a good one here. So scheduling, if I forgot how to do scheduling and I click on that, it takes me right to the scheduling tab. If I want to go back to the main page, I click on this one and it takes me right back to the main page. So it's fairly easy to use. I think after with a short period of time, you'll learn how to use this very easily, and you can always refer back to it. And again, you can print out any page that you might need to for easy reference. Okay, so that is the user guides. Now I'm going to go to the video tutorials right here in this green bar. And again, if I hit the view, it's going to take me to the video tutorials page. And again, you'll notice the same common modules: admin, claims, mobile. And you'll see what we've done is we've basically taken the live webinar, which is typically about an hour long, and we've cut it down into short video snippets. So again, you may just need to remember how to add users, and you can come here and watch a 12-minute and 30-second video by pressing this button, watch the video. So you can see here, as I page down, there are lots of videos, 6 minutes, 3 minutes, 7 minutes, 7 minutes. So we tried to keep most of them under 10 minutes because we realized that, everybody's busy these days, and you might just need a short refresher on how to do things. So they're all at your fingertips, and they're all organized by modules. So you can see there's more than 30 different videos on here, and we are constantly adding and refreshing these videos. So again, lots of content for you. We are working on an FAQ. I know that Georgia is also going to have the FAQ on their EVV website, and we're going to load one on our website as well. The training webinars, we already went over it. This is just another link to take you back to that same page. So that's pretty much it tonight. Hopefully what you've gathered is that the content is consistent and that it's all lined in those 3 consistent modules. We deliver it in multiple different fashions so that you can consume the content on your own time and in many different methods. And you know, training is doesn't have to be a one-time event, and we do encourage you to train multiple different times so you can really learn the application. That way you don't get frustrated when you don't remember how to do something. All right. So I think, Brian, that gives an overview for training. Do you want to stop here and take a few questions, or do you want to keep going?
I think we can keep going.
All right. So there's just a few more slides, and then we'll get to your questions. So third party, we promised an update on the third party vendors. We've shown this slide and the progression of it on every call. So what we've done is we've listed all the vendors here, and then we've tried to color code them so that you can understand the status. So you can see down here what the different colors mean. And obviously, if you're using a third party, you're looking for your vendor on here. If you don't see your vendor, then you can send us an email at integrations@fortellus.com. So that's down here at the bottom. But hopefully you do see your vendor, and then the different colors mean if it's blue, that means they've already completed all the contracting. If it's this orange color, which is only one, that means that they've just declined to do the integration. And if that happens to be your vendor, then you're going to have to speak to your vendor, whether they're either going to change their mind or you're going to have to pick another vendor. Because right now they've declined to complete the integration with us. And then the green in the underline means that they've already begun their testing, meaning they've submitted a test file to us. So you can see that there are a couple on the screen. And as Brian mentioned, we are working with the vendors every single day. And I suspect more of these will move to the testing phase very shortly. Okay, so that is the update on EVV vendors. And again, if you have questions, we can probably take those in the Q&A. And Brian, I think I'll turn it back over to you to talk about upcoming town halls.
So, and thank you for the update. And just to let everybody know, I have seen every single one of those trainings that Joe referenced today, and they are really, really good. I don't know if they're really, really good or if they're really, really good for me. I don't have the longest attention span, so them keeping it, you know, into short, chopped up segments was excellent for me. And also it's very engaging speakers, and it's got a lot of different, like, you know, things visually to keep me focused on the training. As much as I dreaded going through those trainings when I realized I was going to have to go through 31, it ended up not being nearly a chore and actually somewhat enjoyable. So I'm very encouraged by those trainings and you guys' ability to go through the training and see them. So we're still continuing to do these monthly town halls in addition to all of the training. We are going to be targeting the next town hall on 331 and 4.1, specifically on registration. The topic will specifically be on registration. Then for 5 for May, June, July, and August, we're going to hold off and to see if what it is that you guys need to be trained on. That's what we're going to do. We're not going to announce what the topic is yet. We're going to look and see what is the feedback that you all give us that we need to retrain on. And if we don't get any feedback on what would be important for the town halls and the training, we're just going to come and do an open Q&A and answer any single question that you guys may have for these periods of time. We'll sit here and take your questions if nothing else. Okay, next slide. Now we're on to the Q&A. So again, I'm going to encourage you guys, if your questions aren't about training or specific to training, to please utilize this EVV mailbox here. I will send you a written response to every single question that comes in. I usually, just to be open and transparent like I am on these calls, I usually do it on the weekends. So don't be disturbed if you get an email from DCH on Sunday afternoon or Saturday afternoon or early Saturday morning, because a lot of times I just wake up Saturday morning and I clear out that mailbox and respond to as many things as I can. So please do utilize that email box where you can. Okay, let's go through a few questions here. So the question is, you saw that their vendor, I gotta go back up to it, sorry. I just lost the question. Hold on, I'll get there, y'all. Oh, I'm there. So they have their vendor, and their vendor has signed contracts with EVV and tell us they've already know that they're contracted. So what do you need to do? So your system, the ClearCare system, will interact with our system, the TELUS EVV system. So you should be set up to continue to use their system if the testing goes well and everything is okay during the testing phase, for us to be able to integrate and use the system then. So you do need to attend the trainings. You do need to attend to keep in contact with ClearCare, your provider, or whoever your third-party provider is, just to make sure that they're giving you the most up-to-date information. The next question is, will this webinar be emailed to us? We don't typically email them. They are all on the website. Go onto the website, click on the provider tab, and every single presentation, the PowerPoint is fully available to you. You can click on it, you can download it, you can save it, you can do whatever you want. And then this will be recorded and posted there. Me and Joe talking will be recorded and posted there for tonight's presentation and tomorrow's presentation. They are all fully available on our website, and you can get to them at any time. So the next question is again about Acumen. So the plan now for so let me just say this, because I know I said I wasn't going to talk about participant direction or consumer direction, but I am very sensitive and connected to the population. So I'm going to go ahead and do it. So the plan right now for we're working with each of the fiscal intermediaries, including DCI and Acumen. Yes, they were not in blue on the page, as one of the questions indicated, but we are very, very confident. We had a meeting with them today that they will move to the contracted section next week. They will also be putting out an FAQ for you all very, very soon about the integration process in EVV. They did let me know today that they have had a work group with certain family members to address things that have been going on now for over a year. So that was very encouraging to hear as well. So they will be answering specifically to those questions. Again, the only service that is mandated by EVV is CLS. It is not CAI. Community Access Individual is not going to be coming through from the Acumen system to the EVV system. We will only be focused on what is the federal mandate, which is CLS. Another question is, how do we select a third-party vendor? You don't have to select a third-party vendor. You can use the TELUS system and sign up to be a user on the TELUS system. There is no need for you to get a third-party vendor. There is no cost to the TELUS system. The state of Georgia is paying for the TELUS system. If you choose to get a third-party system, we're also not preventing that. You just need to make sure that they are able to integrate with the TELUS system. Your staff, and the next question is, what trainings do our employees need to do? Your employees need to do the training, all the training, unless it has to do with the administrative portal, because that's something you're going to be doing as a provider. Then in all those 30 modules that have to do with, how to use the app, how to clock in and clock out, there's stuff on how to reset your password, all that your employees need to be doing. I think I explained what the third-party vendors are and that you don't have to do that. Will any of the trainings be hands-on? Well, you will be able. You'll have the application, and you'll be able to use the application. So when you look on the website, when you go through the trainings, they are very interactive. They're not like where you're actually punching things, but it is showing you step by step how to use the application. Again, I am not a visual learner, and I'm certainly not a reading learner, but these short trainings were very, very easy for me to use as well. I have a really bad attention span. Again, I've explained, and let me explain one more time about participant direction. The plan for participant direction is for you to continue to do what you do now with the fiscal intermediary, period. You will continue to do what you do now with the fiscal intermediary. You will have to use the DCI system because that is a federal mandate. You cannot continue to use paper timesheets if you are using paper timesheets. But the DCI system and Acumen will be integrating with the TELUS system. So you will just be using their system in order to have your EVV work validated as federally mandated. Community living supports, it does encompass CLE and CLB. That's a question that was asked. Those are just different codes for community living supports. Yes, if you are participant directed for CLS, you do have to use the EVV system. So you will, your fiscal intermediaries are working with us right now to do that. There is no exceptions for participant directed. Supported, the next question is about supported employment. It's not valid for what we're talking about today. It's not valid to this one. So we'll capture this and we'll respond to you individually about that. A question was brought in that said, I came in late. How can I get caught up? Good news. This entire presentation will be posted to the website. So you can go in, you can look at these slides, you can follow along with our presentation in our voice, and it will be there for you to use not only today's presentation, but tomorrow's presentation as well. So should we be setting up an account with TELUS now? No, we kind of talked about that in the presentation. So that the registration is going to be beginning at the end of the month. For EVV, the next question is, EVV system completely replace paper timesheets? It will for CLS and PSS. Yes, it will. You don't, first of all, nobody ever has to apologize about asking questions. So let me say that. The question and answer portion has been very helpful for us in design of the system. So I just have a very direct style in answering questions. So don't interpret that very direct style as the fact that I don't appreciate your questions, because I absolutely positively do appreciate your questions, whether or not they're about this topic. That's why I'm telling you that we'll gather them and we'll respond to them if they're not part of this topic. But I do also want to encourage y'all, because I want to encourage y'all to look on the website, because it's rare that I get a question that isn't on the website, isn't in our FAQs, isn't in our previous presentations, isn't easily available to you guys. And I just want to make sure that you're utilizing those resources, because we won't be here. I mean, we'll always be here with the call center, and the trainings will always be available, and the training manuals will always be available. But this is a federal mandate, and we have to do it. So we need to approach it from a standpoint of how can we get this done? How can we learn it and get on board? So I want to encourage everybody to really, really start to look at the information that is available on the website. So again, the question is about participant directed. You will continue to use the system with Acumen as you do now, but you will need to use the electronic DCI system. Another question is if for community access group or individual. No. Where can I go to find out the role for the EVV process? All that information is available on the website. It's available in the Townhalls. It's available in all of the recordings. All information is available on the website. Every single bit of information is available on the website. So just go there and you can see it. Joe, do you mind backing up to what the one that has the web address? But again, I want to encourage folks. Oh, the web address was just put in the chat box so you can have it. So Joe, you don't even have to do that. So it's right there. But again, if you don't, if this goes away and you don't have that web address and you don't copy it or anything else, you can go to Google or any search engine and put in GA, EVV, DCH, and it is the first thing that pops up. So you can immediately go in and you can get to it from there. So can a Chromebook be used to indicate time in and out? It needs to be a phone. It's going to need to be a phone or an iPad, and not a fixed computer device. So we're gonna demonstrate for you what I'm saying. Look at that. So if you put in DCH, EVV, GA, and any combination, the first thing that comes up is the EVV webpage. And Joe, if you don't mind, if you'll scroll down a little bit for me. So if you want to know what's going on with third party, there's a tab there. Service providers, there's a tab there. Member and advocacy groups, there's a tab there with all the relevant information. Schedule of events, right there. You want to look at future presentations, you can go there. So Joe, will you hit the service providers for me real quick? Thank you. I appreciate it. So if you go down here, what I was telling you earlier, if you get past any of this stuff, here's where all the presentations are, right? So here's all of the webinars that we've done. Every single presentation is available online with every single recording. We are very, very committed to 100% transparency in this process. We're really 110% transparency. Nothing about the project is not available to you online. And that includes all presentations, all recordings. So today's presentation and today's recording will be on here, probably available, if not Friday, first thing next week. Okay. Again, oh wait, I want to go to Q&A because sometimes people put stuff in, not in Q&A, but in chat. So give me just a sec because I don't want to miss anything. And then I think we're close to do. The only thing that is on here that the question that I feel like really needs to be answered is the TELUS free service? Yes. The state of Georgia has paid for the contract with TELUS. So you do not have a charge for TELUS if you use the TELUS system for state of Georgia Medicaid. So you do not have to pay for that. There is no charge. Okay. Again, I want to just wrap up by saying Thank you, thank you, thank you for attending. We had close to 200 people on a Thursday night, which is awesome. Thank you, thank you, thank you for all your questions. I really do appreciate it. If you have questions after this, please utilize the email box. I promise you, we will get an individual answer to your question on the email box, which is also available on the website. Everybody have a good night, and thank you for attending today.
Thank you, everybody.